Good day, everyone. Welcome to the CYC News Conference. Today, we will be focusing on multisystemic family therapy. Let's all go around and introduce ourselves. I'll start us off. My name is Lucas Furtado. I began my work in the field of child and youth care in February 2016. I am in my final year of the full-time Child and Youth Care Advanced Diploma program. I currently have the most experience working with children and youth with autism spectrum disorder. I believe that children need to be listened to more because so many children are neglected by the important people in their lives. As a child and youth care practitioner, I believe it is mine and every other child and youth care practitioner's job to help as many of those children as we can.
Hello, my name is Vanessa Del Gobo. I entered the field of child and youth care in 2016. I am currently a full-time student in my final year of the child and youth care program. I have experience working with children living with dual diagnosed and behavioral disorders. I have worked in schools, residential, and day treatment programs. I believe every child should be encouraged to be themselves and be supported to achieve their goals, regardless of the adversity that they face. I believe that all children should be treated with compassion and respect.
Hi, my name is Lynette Taylor, and I am a graduate from the Assaulted Women and Children's Advocacy Program in 2012. With over 11 years of experience working in the field advocating for women and children since '09, I have currently enrolled in the full-time Advanced Child and Youth Care Program, receiving a certificate in Indigenous Studies. I provide stability, structure to vulnerable youth, and believe all children have something valuable to teach adults. So it is important to be self-aware and attentive to your surroundings, actively listening to what is said, and it is important for their growth and development.
Hi, my name is Chantal Jones, and I am a child and youth care practitioner. I've been working in the field for about 3 years now. I'm dedicated to help improve the lives of young people and their families and advocate for those who do not have a voice. I believe that there's always a chance for you to learn from your mistakes and right your wrongs. Everyone deserves a second chance, and everyone deserves a chance to start over again.
I will now give a brief description of what multisystemic family therapy is. Multisystemic family therapy is a form of therapy that focuses on helping youth and their families and how they deal with many of the elements that lead to antisocial behavior in children and youth, the contributing factors typically found in the children and youth's environment. Some of the causes are lack of problem-solving skills, failing grades, little to no discipline, and association with troubled youth. This treatment is individualized for the family. Many other therapies are used in multisystemic family therapy, such as cognitive therapy. This is used to achieve positive outcomes, which would be minimizing antisocial behavior and providing the family with the appropriate tools and skill needed to resolve further issues. Lynette will now let us know what the traditional techniques identified in multisystemic family therapy are.
Multisystemic family therapy, known as MST, is a mental health evidence-based service that provides intensive family and community-based interventions for youth 12 to 17 years old. The program is designed for youth suffering from antisocial behaviors in juvenile systems, possible substance abuse, youth in imminent risk of out-of-home placement, suicidality, or severe depression. Programs focus on youth functioning better within their natural settings, such as school, home, and community base. Programs are also designed to work with the family's strengths and their weaknesses. MST works with the entire family. It uses the fit circle as a way to identify factors driving their behavior. Sessions last 3 to 5 months with frequent check-ins to ensure success. Techniques are geared after assessment and modified to the needs of the family. Some techniques used are broken into 5 categories. Family interventions improve family functioning, empower caregivers to address youth problems across ecologies. Intervene in peer ecology, decrease association with negative peers, increase association with pro-social peers and involvement in pro-social activities. Intervene in school ecology, improving school behavior, attendance, and performance, intervene in community ecology, improve family connections with informal supports, community resource, and formal systems address community risk factors. And lastly, individual interventions, which is increase pro-social attitudes and skills, reduce other individuals' based problems from parents and youth. Child and youth care practitioners could advance these techniques by including the youth in the initial discussion process. Through research, it has been discovered methods are family-based and utilized within the home, school, and neighborhood settings. One method that should be considered is applying MST with group home settings for youth without parent involvement.
Vanessa, do you mind letting us know who the theorists are that developed this approach?
MST was greatly influenced by Bronfenbrenner's theory of social ecology and the ecological system, and how different aspects of an individual's life are interconnected and can have an impact. By July 2005, MST programs were implemented in 9 countries, including Denmark, United States of America, England, Ireland, Netherlands, Australia, Sweden, Norway, and New Zealand. Many programs have incorporated MST as treatment in numerous programs. MST is now utilized by many mental health professionals, including child and youth care practitioners. Professionals find using MST to be effective as it makes youth more accountable for their actions. Family therapy, training, and counseling help focus on the leading factors of youth crime. Hengeler states that MST helps professionals change their environment by teaching parents and life skills.
Chantel will now demonstrate one experiential activity that highlights the uniqueness of this CYC approach.
Now I will be explaining an activity that you can run with families. This activity focuses on problem solving and communication through the act of role playing. Each family member will come up with a current or past issue that has taken place and they feel was left unsolved. Members will focus on defining the problem, identifying if the problem is even worth fighting for, how they felt in the situation, what to do, state what they feel they need to work on and what others need to work on as well. They must listen and understand each other's perspectives, come up with strategies to solve the problem, and come to a compromise that everybody can agree on. Here is a live demonstration of how the activity will work.
Alright, so hello Jones family, welcome again. Today for this counseling session, we'll be doing a role play, and I want you to act as how you felt in that moment from the situation about Lynette's curfew from last week. So, Lynette, I'm going to start with you. I'm going to just ask you a couple questions. So, define what you think is the problem.
Me being out late with my friends and my mom not liking the fact that they are involved, well, she believes I'm involved in drug use.
Okay. And do you believe this problem is worth fighting over?
No, because I care for my family members.
Okay. And how do you feel about the situation?
I feel like my mom should kind of understand where I'm coming from a little bit. Like with everything that has happened this past year, my father passing, us moving, like, you know, sometimes I just need like time and space for myself, and I really don't have that much friends, so like it makes me upset, but at the same time, like, I feel bad at times because she is doing it all by herself.
And what do you feel that you need to work on to make the situation better?
Well, from what we spoke about, I feel like I could be more understanding and respectful to your feelings, and to spend more time with my brother rather than just coming in anytime I feel I want to, so that it sets a better example for him.
Okay. And we'll go to Chantal. So what is your definition, or what do you feel the problem is?
Well, when I was setting the curfew for Lynette, I felt very upset with her behavior. So I guess the way I addressed the issue about the curfew was I was pretty hot-headed.
I didn't really explain why I was enforcing this curfew. So hearing her reasoning of why she's staying out late, I can understand that. However, as a parent, when your child's coming home late or doesn't let you know when she's coming home, or sometimes doesn't even come home until the next day, I feel very worried and think she's doing something bad, or like my mind just goes all over the place. So I enforced this curfew maybe like a little headstrong. Also, enforcing this curfew wasn't just about you, it was about your brother and how he's viewing your behavior as acceptable. He thinks it's okay to come home late now, and he's only 12 years old. So I know you want to hang out with your friends, but you do have to come home at least a decent time. We can compromise on a time, and you can't come home intoxicated, because then you can let me know you can sleep at a friend's house. And do you understand where I'm coming from with the curfew and the behavior?
Yeah.
So Lucas, what is your perspective on this problem?
Well, I mean, I don't really see my sister as much as I'd like to. I mean, since my dad's passed, I've really been trying to look up to her, and because she's pretty much my role model now. And yeah, I don't see her. I notice sometimes when you come home, you smell weird. What is it?
Oh, it's this perfume that I have, the new perfume.
Did you buy it from the dollar store? Because it smells awful.
Oh, I didn't really notice, but I guess I'll get a new one if you don't like the smell.
Yeah, that'd be nice, because you stink up the house with that awful perfume.
Lynette, this is perfume, right?
Yeah, it's perfume.
And if it's not, we're gonna stop it, right?
Yeah, because it's only perfume. I'll buy a new bottle.
Mama, it's perfume.
Okay.
Alright. So, what are some strategies that you guys think you can use to resolve the situation after hearing each other's perspectives?
Me and Lynette can just go out, so Mom won't have to worry about me being at home alone. I'll be out with Lynette.
I'm glad you want to spend time with your sister, but she also has a life and she wants to spend time with her friends, and I do understand that. So I feel like I can make myself more available to spend time with you and to spend time with us as a family in general, or we can set up play dates with some friends at school, get you guys to have more friends. And I feel that addressing your father's death is very important for us to move on, and I feel that's something we can do together. And Lynette, I do understand that you want to go out with your friends, but if you would just communicate with me that you're coming home late or that you're sleeping over, I would really appreciate that.
Does Lynette not want to spend time with me?
No, I do want to spend time with you. Sometimes I just want to be alone.
Or be with your friends. Don't you want to be with your friends sometimes too?
Yeah, I guess so. But it'd be nice if Lynette came too.
I think that would be nice sometimes.
I think I could do that and make some more time for my brother.
Sounds good. So now that we've come up with the strategy plan, we will continue with the follow-up next time we see each other, and to ensure that what we said here is going as follows. So thanks for coming in today, and I'll see you next time.
Thank you everyone for coming today and contributing to this conference. Hope you all continue to have successful careers.